Time once again for another edition of Wellness Wednesday with Dr. Bradley Meyer, the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave. Made it into the clinic bright and early, despite the 2-hour late start. So here we go. We're excited to be here.
There you go. This is something we don't do very often here on Wellness Wednesday. We're going to have a little book review.
Yes. And I'm very grateful for my wife because, I like to read a lot of medical education books. So does she. But many times as I am in the day-to-day, or kind of like in the trees of the forest, instead of looking down from the satellite view on the forest, it's nice to be able to do both at times because it gives perspective on things and life and medical directions that we may take at the clinic or with individuals that come to the clinic. But so much of it's the psychology of the human psyche and where we're at. We've talked about it with Michael Sheridan, some traumas, where our nervous system sits. Is it in the sympathetic, parasympathetic state? But Carrie always finds good books. And one of them she was reading recently and shared with me, and it was talking about when it comes to our guests that come in, it's really our job. We have a lot of duties, not only to help offer options and different paths that might have not been thought of or taken before with the folks that walk through the door, but to kind of be a mirror a little bit or to reflect and ask them the right question of where is it that you want to go? And part of that acknowledgement of trying to figure where we want to go, whether that's health-wise, spiritually, we might in many cases have to acknowledge that not everything is okay with us. And I think we, at times, this is all of us, for the most part, I would say, myself included, as I've also been on my own health journeys over time, with inflammation and gluten and such. And we have to acknowledge again that not everything is okay. So a lot of times we will say to ourselves that, well, I've got some more fatigue than I used to have. I've got some joint pain, and these things kind of pile up. I'm kind of stressed. I don't sleep very well at night. My brain's just not quite as sharp as it used to be. Name recall, thinking of that short-term memory. Digestion's off. I'm bloated after I eat. I'm constipated. I'm not eliminating. These kinds of things. Eventually, we get pretty good at rationalizing these things and just shoving them off on aging. We've talked quite a bit about that, Dave. Is that it's great when folks start to realize that there is such a thing as chronologic aging. Yes, we have birthdays every year, but there's also biologic aging, which we've touched on in the past as well. A lot of us will age differently. And so you may notice somebody that, that's your age that looks younger than you, or somebody your age that looks quite a bit older than you. Oftentimes we'll have folks that come in and say, golly, doc, I'm 44, but I feel 64. So we want to get onto the other end of that. We want you 44 and to feel 24. But a big piece of that, again, is where is your nervous system, where is your psyche, and identifying where do you want to go. And you can apply this to anything in your life. If your house, a project that's not been tackled, whatever it may be, acknowledging if there's something out of place or out of balance, that's probably that way because something's not okay. And so we are a wonderful team here, ever-growing team at the Okoboji Wellness Clinic. We have so many different giftings here with different team members we get to work with that all have the same spirit. We want to help in that hope and that healing and that quality of life. We want to help show you where you want to go. And we want to be there to to guide you, to be that guide on that path. But ultimately, it's your journey, and it's, you are the hero of that story, and we want, because everybody, if we're living our best, the world's going to be a better place. And so, we have our pillars that we stand by. We have mitochondria, which is the driver of our energy. Many times we're going to focus on that. And again, we've talked, if you do a PubMed search on any chronic disease, Dave, look up mitochondria, and you'll find a link to mitochondria. And so if we can help make that mitochondria work better, that's part of our job. We want to make your nervous system work better. We want your GI system, your gastrointestinal system to work better. We want that. We want less intoxication and you to be detoxing the poisons out of your body better. And so we do this with we keep expanding our toolkit, because everybody's a little bit different. We want to personalize that tool and especially say, okay, is ozone going to be best for you? Is neurofeedback going to be best? Is hyperbaric? Is it going to be a certain kind of nutrition plan? Is it just going to be drinking more water? So we have one special gal that just started her journey this week, and she came in from South Dakota, and again, I think maybe 20 years or so of not thriving, kind of just surviving, been through a lot of medical workups, a lot of chronic pain, a lot of fatigue, brain fog, digestion is off, and we're about ready to get going with her. She started this week. She has done some big work to acknowledge that, hey, not everything's okay here. I can feel better, and I want to feel better, and so she's started that journey, and that journey is out there for everybody that doesn't feel like they are quite where they need to be. And so take advantage of the fact that we've got a compassionate team here in Northwest Iowa that is ready to take a individualized approach to working with you on that walk, on that wellness walk, Dave.
Yeah, one of the things that I think people have come to realize, that the Band-Aid medicine, that we've all been through it, and we just kind of think, okay, this is the way it's going to be. But it doesn't have to be that way. There are opportunities to be your own advocate, to go into Dr. Bradley Meyer. I remember one of the first conversations that we had. I think an elderly lady had, I think the terminology is drop foot. And she had been, other medical professionals came in to see you, and she would not accept that was going to be her fate. And she came in and said, listen, somebody's going to make me thrive. I'm just not surviving this.
Absolutely. And those are the stories. It's that indomitable spirit. If folks are coming in that space like she did, she had made up her mind this was not going to be her fate. And that she wanted answers. She wanted to get into that healing space. And I believe we did some hyperbaric therapy with her at that time. And sure enough, that foot drop went away. And so those are the kind of stories that we're blessed to be a part of on a weekly basis here. And it's a journey, but it is really exciting to see somebody that has been bothered with a multitude of unwellness or not feeling well for 10 plus years, that we get folks working with our amazing team, and even as little as a month or two, for somebody that was suffering for 10 to 20 years, they start to see change. And they start to have less pain. That foot drop goes away, or the brain fog starts to lift. All of a sudden, their energy's up, and these things start to peel off, and then they develop some hope. I guess this isn't my fate, and I'm going to continue to work towards a healthier lifestyle because I'm actually feeling better. So many times, many folks kind of have an idea what it is like to work on these things, but they get discouraged because after, working on them for 4 to 6 weeks, maybe they don't see a significant change yet. Whereas when we find kind of the right combination for you and you go down that path, when you see those changes for yourself within a 4 to 8 week period, wow, is that inspiring. It's inspiring for us, and it's certainly inspiring for our guests. That hope, that flicker of hope becomes a flame and eventually a fire of excitement, and then we just build on that momentum. We keep building, knowing that there are days, there's ups and downs in the journey of wellness, but we keep building. And then over the course of that year, many times a lot of folks come back in and be like, "Wow, I forgot that I had X, Y, and Z a year ago." And we look back at their first visit note and we're like, "Wow, okay, yep, that's gone. Okay, well, there's always something to work on. What's next?" And that constant improvement. So
we got to get going here, but I've got something else I want to quickly cover. But I can't even fathom what it's like to feel awful for 10, 20 years and then finally get some relief. It's got to feel like the greatest gift in the world. But we are going to have a political explosion over the next couple of weeks over this health care. The cost of health care, the cost of health insurance, the cost of Obamacare. People are not going to be able to afford insurance. People are going to turn to a direct primary care model. They're going to have no option because they're going to be priced out of health care. This is an area that you saw coming, and so if you can, quickly tell people what that direct primary care model is.
Yeah, it's a wonderful model that it's $99 a month for the individual, and then that's unlimited office visits with myself, and it's both acute and chronic situations. So if you've got like a cold coming on and you want to get in to have that addressed, we get you in, we take care of that. We can also do it over the video or the telehealth on the computer or a phone call. But it is a great opportunity to plug in to a wellness-centered, mission-centered practice that utilizes a mixture of holistic tools where, I still prescribe medication, though the times I'm a bridge to help folks. They want to try to get off as many prescriptions and medications as possible. And at $99 a month to work on that process, and that's to be a part of a space where a lot of really cool things are happening. That's a great opportunity, and I think that the DPC model is going to continue to grow across the country for the reasons you just shared.
Yeah, they're going to turn to direct primary care. They're going to have a catastrophic plan, the cheapest catastrophic plan they can find, and that's how, at least for now, it looks like health care is going to go. All right, listen, how do folks maybe have a discovery call with you or stop in? What's the best way?
Please give us a call at 712-339-6024. If you want to set up a 15-minute complimentary discovery call just to discuss some of the initial steps with us at the clinic here, what that may look like, and make sure we're a good fit. And then if you want to schedule an appointment, you can do that as well. They're 30-minute or hour-long appointments. You can make appointments directly with Molly Avery to get started on a functional integrative wellness journey. Same with Michael Sheridan to work on the nervous system, reflexive brain work. You don't have to see me first to see them, but if you want to, talk nutrition, talk detox, talk supplements, Molly's great with that as well. So lots of options. We're at 3305 Berquist Avenue, just off Highway 71 in Spirit Lake.
Very good. Dr. Meyer, always a pleasure. Thrive, not just survive. Perfect mission as we head into the holiday, Christmas holiday, and into the new year. Dr. Meyer, thanks so much. We'll chat again soon.
Thanks, everyone. Be well.
Thank you, Doctor. Dr. Bradley Meyer of the Okoboji Wellness Clinic. You can find out more as well, okobojiwellnessclinic.com.